Hey guys, it's Dr. Z. So I want to say something that nobody in the media is saying, which is thank you. Thank you to our frontline healthcare professionals who are the ones risking their lives with terrible staffing, equally terrible leadership in many cases, terrible government planning, terrible preparation, but they're the ones there taking care of patients during this COVID-19 epidemic that people are terrified because of the media hysteria about this thing, but you go into work and you take care of these patients, even when those same patients are stealing your personal protective equipment and your masks out of your supply closets, even when your own so-called leadership are looking more like poor managers than leaders. There's no leadership happening. You're still the ones touching the patients every single day, putting yourselves at risk. In China, we saw so many healthcare professionals get sick because they're going towards danger when others are running away. Our paramedics, our EMS, our staff that work in nursing homes, they're all putting themselves at risk to take care of our most vulnerable. We did it during swine flu, we do it during SARS, do it during Zika, it doesn't matter. That's what you are called to do, and you do it, and thank you. And what the rest of society should do is elevate you on a pedestal, give you the resources and the tools and the autonomy to do what you do best, which is care for others and keep you safe. Because we know, especially with our frontline nurses, they will sacrifice themselves to keep others safe. And we don't have to do that. It's called leadership and planning. We've had time to prepare for this, and what have we done? It's still a mess, you guys. So I'm asking our leadership to lead. Stop trying to manage. Help resource and support our frontline healthcare professionals, because otherwise, I'll tell you, their morale is already iffy. Here in the Bay Area, people are struggling, but they're doing their job. And I remember it happened during swine flu. It's the same thing, but we need to support them now. Better protocols, better resources, better PPE, better education of patients to not come in if they don't need to, so that we can manage them remotely and offload some of the stress that's happening. In Italy right now, the hospitals are overwhelmed. In China, a quarantine hotel collapses. Like, this is the time when people who are called to help others rise up and stand. And if we don't support them, we're complicit. All right, guys? So here's the call to action. Share this video with your leadership, with government officials, with someone you love who works in healthcare, all right? To support them and say, you know what? Thank you for what you're doing during this difficult time. All right, guys? I love you. We out.